And then the other thing to think about, related to kind of the healthy diet, but is obesity.
Yeah.
And it is such a tricky topic, right? In general, and we all know weight loss is incredibly hard. I see a lot of postmenopausal patients who really struggle and they feel like they're doing everything they can. And with the hormonal changes, they still gain weight. But we do have really clear data that people who weigh the same when they're postmenopausal as they do when they graduated from high school, which again is a very tricky thing to do, but it turns out that actually is very protective against breast cancer. And I think for most people, we believe that is that inflammation component of obesity that's contributing to cancer. So wherever you can get nutritional support, get community support to try to maintain a healthy weight really is huge from a cancer prevention standpoint.
Hey everyone, welcome back to the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and I'm excited to bring you today's guest. We're going to talk about a little bit of a different topic for the podcast, but one that I think is really important and pertinent to a lot of the listeners, and that is breast cancer. So we're talking with Dr. Ziv Peled today, and she is based in San Francisco. She's a surgeon, an educator, a researcher, a mother, an athlete, and a breast cancer survivor. And just a few years into starting her own thriving breast cancer and plastic surgery practice, Anne was diagnosed with breast cancer herself. So she has an unusual perspective between being both the expert and the patient. And I think that's a perfect place to start. She did give me permission to call her Anne throughout this interview. So Anne, thank you for coming on the show and sharing your expertise today.
Oh, thank you so much for having me, Morgan. I really appreciate it.
Yeah, let's go ahead. And I kind of like just to hear everyone's background. Why did you become a surgeon? I told you offline, my brother is a fellow at Vanderbilt right now for plastic surgery. It is an intense, arduous, long, test-filled, competitive process, and you have to sacrifice so much of your personal life to be a surgeon. And I was just wondering, what drew you to this profession in the first place?
Yeah, so you're right. I mean, I think it comes with all of that. For me, though, I was lucky in many ways to see early on what it was like to have physicians in the family. Actually, both my parents are physicians, and they're actually both breast cancer specialists. They're oncologists and radiation oncologists. But I started doing breast cancer research when I was 15, and honestly, really from an early age, knew that I loved that relationship with patients, being at this incredible time in people's lives to really change what their future looked like. And I went to medical school. I was thinking I was going to be an oncologist like my parents. And literally my first day on surgery, I just fell in love. I love the operating room. I love the environment. I love that time in a patient's life where you really get in, you have something concrete that you get to take them through, get them on the other side. So it has been a really long journey. I did both a plastic surgery residency and then went on to do a breast cancer surgery fellowship. So it was a lot of training by the time I got out. But honestly, I started my own practice in 2015 and co-lead our breast cancer program at my hospital and would pick this job every single day, despite everything that it's taken to get here.
Yeah, that's awesome. So let's talk a little bit about your own personal story with breast cancer. Was it a general screening, or were you doing a self-exam, or how did you find that? And then what were you thinking, like when you were first diagnosed?
Completely. So for me, I was actually diagnosed at 37, which is before, at least in this country, we recommend starting screening at age 40. So I wasn't even getting breast cancer screening. I had no family history of cancer. I felt like I was doing all the right things, a vegetarian, triathlete, and I was breast cancer surgeon. But it was like many people where I felt a lump in my breast. I was glad I was doing self-exams and took the advice I give my patients, which is if it doesn't go away after a week or two, you have to tell someone. So I have to tell you, I mean, as many of us know who are in healthcare, getting a healthcare related diagnosis it hits you so hard when you're in that place. And I did my biopsy, and then the next day the pathologist called me to tell me it was invasive cancer. And again, like everyone, that initial shock, that disbelief, could have messed up my pathology? Is this someone else's? But I think for me, I feel honestly at this point, it's been 5 years now. I feel incredibly lucky to have been able to get such great care, but I also really connect with my patients in ways I never did before. And I know what this journey looks like. I know what they're going through when they get diagnosed. I know how to help them through treatment, my little tips and tricks, and what it feels like to be on this decision-making piece of it. So honestly, I often think of it as a true silver lining of getting a really scary diagnosis.
Yeah. So did you have a genetic predisposition to breast cancer, or like, I can imagine if I was in that position too, I would be like racking through my medical history and my family history and my habits and be like, what did I do to contribute to this? Did you go through that?
I completely did. And I really, you feel responsible even when you feel like you're doing everything, especially getting diagnosed young.
Yeah.
Which is unusual. But for me, I didn't have a genetic predisposition. I did genetic testing. But what we are seeing actually a lot of is more and more diagnoses at a younger age. And in some ways, it's really scary, right? It makes us wonder what's going on. Are there factors? But what's incredible about breast cancer is we treat it so well. So whether you're diagnosed at 28 or 88, we treat breast cancer in ways that it is highly survivable for most people. And so when I got diagnosed, as scary as it was, I tried to tell myself what I tell my patients, which is you're going to be okay, and you're going to be okay on the other side of it. And fortunately, I'm at that place now.
Yeah. So what was your treatment like then? Did you have surgery? Did you have chemo or radiation, or what was your process like?
So we now have wonderfully testing that actually can tell people based on their tumor genetics, essentially of their tumor, whether or not you need chemotherapy. And I feel really lucky to have benefited from this technology, these advances, because honestly, a decade ago, I was diagnosed at 37. Everyone would have given me chemo, but I had testing and it said I didn't need chemotherapy, which is pretty remarkable. So for me, I had surgery followed by radiation. And then I've been on hormone blocking therapy for 5 years, which actually I got to stop this week because I'm done with my
Nice.
5 years. So I had my last dose actually last week. So each of those pieces have different, as you could imagine, different challenges to it. But I think for me, what really got me through all of it from a side effect profile, from a healing, is exercise. And that's been so consistent for me. We have really good data that exercise reduces your risk of recurrence. And it's one of my favorite things to talk about in general, because there's so many benefits. And really, we often talk about, can we prescribe exercise to people? And I do think that in many ways, we really should be, as cancer specialists, as people interested in prevention of diseases.
Totally. I'm all for that. We always say prevention before prescription, like talking about pills, but prescribing lifestyle changes. Yes, we're all about that. So I think, didn't you and your husband develop a pretty special surgical procedure kind of when you, was that when you went through your breast cancer? Will you talk about that? It's a little bit technical. And when I first got your pitch email, I don't know anything about this stuff. And so I texted my brother and I was like, is this person legit? And he and he was like, yeah, her husband just came and taught us this technique at Vanderbilt. And I'm like, she's legit. Let's have her on. So can you talk about that technique and what is it and how is it different than what was happening and what are the benefits of the technique?
No, thank you so much for asking, because I do think even though it's not necessarily in the prevention space, the reality is 1 in 8 women are diagnosed with breast cancer. So all of us will be or know someone who will be. And one of the reasons that this is so important to me is, having gone through it myself, you really think when you're in that position of what is the impact going to be on your body. And many women who get diagnosed young choose to have double mastectomies to kind of reduce the chance of cancer coming back or having screening. But one of the things with traditional mastectomies is your chest is totally numb. And one of my good friends who had a mastectomy a couple of years before I got diagnosed, she said she puts on a sports bra and doesn't know it's on. And I just felt, at any age, but especially 37, to be thinking about that for the rest of my life was just too daunting. So I didn't have a mastectomy primarily for that reason, but my husband is a peripheral nerve surgeon. And literally, we're talking over dinner in the midst of my diagnosis about why this had to happen. And we kind of came up with a technique together that allows us to safely keep nerves and not injure them during mastectomy surgery, and then reconstruct them as well. So now we've done, I think at this point, over 700 of them over the last 5 years. We present our data all over the place and are teaching other surgeons how to do it. And it's so exciting. I was just at a breast cancer meeting last week, and truly it's making this the new standard of care, so that women don't have to be totally numb after having mastectomy. So again, that's kind of been the very best part, the connecting with patients, and then the getting to actually change the face of this so that people have options that I didn't have, is one of, again, it's this like completely unexpected silver lining that gets me excited every day to come to work.
It's huge. So you're saying that people can have that double mastectomy, but preserve their sensation too.
Exactly. And it's everything from feeling hugs from your kids, to being able, and a patient yesterday told me how nice it was once all her sensation had come back, to feel the water in the shower being warm. These are the small things we just take for granted. And then you get this diagnosis of cancer, or you get a diagnosis that you have a genetic mutation that may cause cancer, and you're choosing to reduce your risk, but you have all these side effects of it. And it allows people to really feel like themselves again, which in my mind is the thing we all hope on the other side of cancer, is to get people to get back into their life. It's such a disruptive thing to go through. So if we can have people feeling like themselves, doing the things they love, being with the people they love, in my mind, that feels like a huge win.
That's incredible. Like, what a cool silver lining to come out of a cancer diagnosis at that age. You just happen to be married to a peripheral nerve surgeon.
Totally. It's all the pieces.
So yeah, kudos to you. Big acknowledgement for just like making the very most of that circumstance. And then, yeah, being a huge advocate now, again, for this surgical technique to preserve the quality of life for a lot of women. And that was one of the reasons that I wanted to have you on the show is, I think a lot of people, they hear what their doctor is saying and they just take it as fact. And so I wanted them to know that this surgical option was out there, and to seek a physician who may be skilled in it, so that if they were in the place where they needed to also have a mastectomy, that they could have that option and know about that option and share it with a friend. If they know a friend who has breast cancer and is facing that option, like this is an option. Just because one doctor may not know about it yet, it's out there. So thank you for spreading the word about that.
Thank you for doing that, because again, it means so much, because again, there are people who are going to hear this and now know that exists, and then also know to advocate for themselves, because what you said is so true. And I think we're all guilty of this as healthcare providers, is we often offer what's in our toolbox and don't often offer things that aren't. And as a result, people don't always get the full spectrum of options. So I really love that you're allowing your listeners and the downstream effect from that to be able to know that they can advocate for themselves.
Do you call it anything? Like, is it the Peled method, or?
It's so funny. My dad asked me the other day, he said, you should trademark it as the Peled procedure. I said, Dad, I don't mean that. But what we call it is sensation preserving mastectomy.
Okay. That makes a lot of sense. I just wanted people to know what to ask for.
Exactly. Sensation preserving mastectomy is the perfect thing to ask for if you need it.
Okay. Perfect. And we'll link up Anne's website in the show notes in case someone wants to contact her team if they have any questions, or if they have like, I don't know, is there any way to find a physician that's trained in this yet?
Yeah, so it's really nice. So we have people reach out to us a lot, and we try to get people to not have to travel to us and get them tucked in. There's also a great website called Resensation, and that actually has a surgeon locator page, and that helps too.
Resensation. Okay. I'm going to take a note of that really quick so that we can link that up in the show notes as well.
Perfect. Okay. Thank you.
Yeah, thank you. So for someone my age, I'm 33, and honest to goodness, I don't do breast screens more than like once every 6 months, which I know is maybe a problem. Just went to my OBGYN for a physical, and I'm fine. She said that my breast tissue feels fine. But I feel like I'm thinking about prevention at this stage. My grandma has had breast cancer. I don't know anything about my genetic predisposition. But what would you tell me as a 33-year-old that I should be doing to prevent cancer? Like, how often should I be doing those self-screens? When should I be looking at the mammograms and that kind of stuff?
Yeah, so I think what I always think is there's two pieces. There's kind of the prevention sort of risk reduction part, and then there's the screening to find cancer if it's there.
Okay.
And the screening part of it is a little bit more straightforward in that, yes, in a dream world, breast self-exams once a month, really kind of looking at your breast, doing it at the same time monthly. So if you are having periods, you're kind of feeling the same thing every month, and really making sure you look at your breast, then you're checking all parts, including under your arm. And so in a dream world, you're doing that once a month. The reality is many younger women have denser breasts and they can be lumpy and bumpy. So I always say, try to do it. But if it's stressing you out, just know that seeing a healthcare provider, your gynecologist once a year, and getting a good breast exam, if you're not at strong increased risk because of your family history, is reasonable. And then in that setting, assuming you don't have a strong family history, and for you with your grandmother, probably being after menopause, that risk is probably only minimal for you. So you probably would fall into kind of a standard risk category where you could start getting screening mammograms once a year at age 40.
Okay.
That's kind of recommended. Certainly, like in my situation, if you ever felt anything, you're worried about anything, do go get it checked out, and you might get an ultrasound or mammogram earlier than 40, but 40 would be fine for most people.
Okay.
That's kind of the screening piece of it. And then there's the prevention risk reduction part. And, I wish that we had some magical way to reduce all kinds of cancers, but like most of cancers, breast cancer is multifactorial. So meaning that there are different pieces we can do to try to reduce risk. Truly the most important one, as I mentioned a little bit about exercise. So American Cancer Society recommends 30 minutes of exercise 5 days a week at minimum. And anything counts. So you can walk, you can do yoga, you can play with your kids, but it's getting active and moving your body helps with inflammation and probably actually has a real impact on your genes to reduce your risk of all kinds of cancers.
Mm-hmm.
So that's kind of my favorite one to tell people. Plus it feels good on many levels. The next one is thinking about what we eat. And we do know that concept of a rainbow diet does make a difference. And personally, I like to focus on positives rather than kind of what not to eat, but what you do get to eat. And so I always tell people, if you can look at your plate and hope that at least, half, 2/3 of it is filled with bright colored things, whether it's salmon, whether it's kale, whether it's blueberries, but kind of bright color foods, that helps and reduces your risk. Alcohol is a difficult one to talk about, especially living in the Bay Area with Napa, 30 minutes from here. But risk reduction does correlate with alcohol in moderation. So it doesn't mean you can't drink, but if you are someone that does have a family history or an elevated risk, we do recommend about 3 to 4 drinks a week as kind of the sweet spot, and probably no more than 6 to 7 a week for women. And so those are kind of the big things you can do to help reduce your risk and get you to kind of a lower place where routine screening should pick up something early and you're bringing down your risk.
Okay. I want to dig into that a little bit more on risk reduction as it relates to insulin resistance, because we kind of talked offline about that. Before we do, can we talk about what might make someone in the higher risk? You said I was in the standard risk category. Can you talk about, is there a low risk? Is there what are the risk stratifications? And then how do you know if you're at a high risk, and what would that look like from a screening standpoint?
So right now we kind of divide people up into 2 categories, either you're kind of average risk or high risk. And high risk in our world is defined as your lifetime risk of breast cancer is calculated at greater than 20%. So standard risk, 1 in 8 women, is around 12%. And so it's actually not that hard to fall into a higher risk category. But the question is really, how far are you in that category and what are you going to do for screening? So the things that put you in higher risk: family history, but typically that's going to be first degree relatives. So mother, sister, multiple family members diagnosed young will also put you in a category of higher risk. Having had prior radiation for something like Hodgkin's and other kinds of lymphomas puts you in higher risk. And then having prior biopsies with atypical cells, I always think about it, kind of tells you your body is already doing kind of slightly abnormal things and puts you at higher risk. So there are actually calculators online you can use and put in your data about all sorts of things, your age, your family history, and give you a risk. If you do have, though, a family history of breast cancer, particularly, again, younger family members, multiple, I do recommend at least talking to your healthcare provider about whether or not genetic testing would make sense.
Yeah.
It's pretty amazing now. They actually have really great genetic testing that the out-of-pocket is, even if you don't qualify with insurance, is actually very low. And then you can get a true sense of, is there a genetic mutation? Because some of those increase your lifetime risk to as high as 80%. So in that setting, people would often do something more involved and more active, like having increased screening with mammograms and MRIs, or even considering taking medication or having a surgery to reduce their risk in the future.
Okay, thanks for clarifying that. And then we talked about the prevention side. You mentioned kind of focusing on color on your plate. We're all about that. I think phytochemicals are so important. I talk about an interview I did with Dr. Bill Rawls, and that was one of my favorites. It was just, he talked a lot about the protective benefits of plants, and we advocate a low insulin and inflammation lifestyle. So typically a lot of people will, go on the lower carbohydrate, but there's a lot of plants that you can still enjoy on a lower carbohydrate diet for those antioxidants and the fiber and the phytochemicals. So we talked about that, talked about exercise. Love exercise. As a PT, I'm all about it. Now, what about like stress and sleep? And I wanted to know if those were really, we talked about alcohol, smoking, like what are some other lifestyle factors that really do contribute to an increased risk of cancer that you're aware of?
So we do know the inflammation piece of it's huge. And it just makes sense, right? If you think about cancer as uncontrolled cell growth of some kind, that having that inflammation is going to play a role on those mechanisms that lead to that. So I think about that. Everyone's a little different what that looks like. And I think it's really personally really important to say, as a cancer survivor, as a cancer provider, none of us are fully responsible for the things that happen because all the pieces come together. So I think there's a lot of blaming. When people come, I had someone recently who had a recurrence of cancer, which happens, unfortunately, and she's going to be fine. She said, "Oh, I really wish that I had worked less and my job weren't so stressful." And that really, it hurt my heart to hear this poor woman in the midst of something terrifying from a medical standpoint, who's then blaming herself for it. Yeah. So what I like to tell people is, look at where you can try to make changes, but know that none of it is perfect, but it still helps, right? Even if you get diagnosed, it's going to help you on the other side from a recovery standpoint. It's going to help you with side effects. So when I think about the inflammation piece of it, sleep is huge, right? And again, it's different for everyone, but that is something we all could benefit from doing more of. The concept of stress is such a tricky one. But again, in my mind, it's trying to minimize and trying not to have multiple areas of your life that are incredibly stressful. There's actually really good data to support that having better emotional connections and connectivity in your community decreases the chance of getting cancer. And I think a lot of that is because if we have stress, having people in our life to help support us through it helps mitigate some of that stress, which I think is huge. Smoking in general is always a good idea to not be doing, but actually breast cancer, that link is not quite as clear as with other cancers. But again, as I always say in my big, huge slide, when I give that, don't start smoking, to make sure you avoid that for everything else. And then the other thing to think about, related to kind of the healthy diet, but is obesity. Yeah. And it is such a tricky topic, right? In general, and we all know weight loss is incredibly hard. I see a lot of postmenopausal patients who really struggle and they feel like they're doing everything they can. And with the hormonal changes, they still gain weight. But we do have really clear data that people who weigh the same when they're postmenopausal as they do when they graduated from high school, which again is a very tricky thing to do, but it turns out that actually is very protective against breast cancer. And I think for most people, we believe that is that inflammation component of obesity that's contributing to cancer. So wherever you can get nutritional support, get community support to try to maintain a healthy weight really is huge from a cancer prevention standpoint.
Yeah. And then if someone doesn't know the physiology behind it, it's just excess fat in your body can produce inflammatory substances. So it does contribute to kind of that low grade systemic inflammation that we know just drives all sorts of diseases. And that's kind of a segue into insulin resistance. We know that inflammation can contribute to insulin resistance, which can contribute to breast cancer and other types of cancer too. Is there anything else specifically that you wanted to talk about related to insulin resistance and cancer risk?
Yeah, I think I wanted to, when people get diagnosed, I think the instant thing is to kind of think about, stopping sugar right away, stopping alcohol right away. And again, I try to be careful with people because it's hard to make major lifestyle changes in the midst of something really stressful. But I will say, I think when you're at a point where you're thinking about insulin resistance, you're thinking about what you're putting in your body and what that looks like, people do feel better. And I see that over and over again, that people get diagnosed with early stage breast cancer and they use that as a tool, as a motivator to make lifestyle changes, primarily around sugar and carbohydrates and alcohol, and people do feel better overall, and it changes a lot of their other health parameters as well. So I guess I would say, if you are someone that is diagnosed potentially and insulin resistance is an issue, obesity is an issue, that actually making those lifestyle changes is going to be beneficial across your world and is also going to be helpful with side effects. So good example, hormone blocking therapy. Side effects are real for some people, but what we see regularly is people who are closer to their ideal body weight are making choices so that inflammation is lowered, and also are exercising regularly, are much less likely to have side effects of the medications that they're taking. And so I think that's a huge motivator, even if you've already been diagnosed, to make these changes still and know that that's going to impact your recurrence and also how you manage your side effects.
Now, the hormone blocking therapy, will you explain that just a little bit more and what it does, and then what are some of those side effects that you were speaking about?
So the general concept and idea is that can we reduce the impact of estrogen and progesterone, but primarily estrogen, from acting on breast cancer cells and on your breast tissue as a whole? And so if people have breast cancers that are sensitive to hormones, which is the vast majority of them, we can actually take, it's a pill in most cases, though there's some other newer kinds that are in different ways of injections, but typically a pill that's typically given for somewhere from 5 to 10 years after your diagnosis. And what that does is it's called kind of a selective estrogen receptor modulator, and it's basically blocking estrogen from acting on your breast cancer cells, both to reduce the chance you get cancer back in your breast, but also in the rest of your body. So if you do have some breast cancer cells somewhere else, it can help reduce those from becoming, developing a metastatic breast cancer, stage 4 breast cancer. In terms of side effects, it's pretty varied, and it depends on your age and other factors. But the main things we see are kind of things related to menopause type symptoms.
Yeah.
So people can get sleep disturbances, they can get hot flashes, they can get emotional disturbance, kind of all the things we see with hormonal changes in general. The other thing that happens with one of the classes of these that people take if they're postmenopausal is a lot of joint pain. And that's where this exercise piece, getting physical therapists involved, is actually so helpful, because a lot of people think they have to just live with that it's a common side effect. But the reality is, once you start moving, once you start thinking about what you're eating, I see dietary changes make a difference, again, as you would well know and understand. Yeah. And then getting people in to work with physical therapists to help them with symptoms, to help them with getting active again, really does make a difference. So there's a spectrum of side effects, but many of them, for instance, sexual side effects, we can treat very well. So I really tell people in general, you don't have to live with the side effects of these medications, but if you don't talk to your providers about them and that you're having them, same for everything, people don't know to help you. So a lot of times I think people, they don't want to hurt our feelings, right? And tell people, oh, I'm having these side effects, but please tell us. I want to know how you're feeling, because otherwise we can't help get things better.
Or they might just assume that there's nothing, oh, I have this, but nothing can be done. So I think it's always great to advocate for yourself. Is weight gain one of those? And I ask because in menopause, as estrogen goes down, the degree of insulin resistance can go up, and we might see like some more essential belly fat. And I was wondering, because they are a selective hormone blocker, it sounds like, I was just wondering if that was a side effect too, like weight gain or more belly fat.
Yeah, so weight gain and belly fat can both be a side effect. It's a little confounding because a lot of people who go on this are either perimenopausal or in the early postmenopausal phase, when just exactly like you said, that's when people are gaining that. So in studies, it's hard to tell, is it going through menopause, or is it that the medications put you into menopause, or is it the medications per se? I will say anecdotally, and this is kind of to make people like myself who get diagnosed young feel better, I do think the farther away you are from menopause, the less likely you are to have some of these side effects and things like weight gain, because your body isn't experiencing hormonal changes on top of the ones from the medication.
Totally. Okay, cool. Thanks for sharing that. Do you have anything else about the prevention, the screening, the treatment? Maybe if you wanted to speak more on treatment, because we wanted to talk on recovery as well. But before we get there, anything else that you wanted to add?
I think that one of the things that I often try to talk about in these contexts is, obviously getting diagnosed with cancer is incredibly scary. But the very best thing we can do is to get people diagnosed early. And so going in to get a mammogram, I always like to share pictures on social media of what it looks like, because people are terrified. Like, what does that actual process look like? And does it hurt? And how does that feel? And what if they find something? And I guess I would say all of these things, they are really scary, but if you feel something abnormal, trust your body, go in for screening, because again, we can treat cancer when it's caught early. And so being terrified of that experience and not going, unfortunately, long-term doesn't help. So that's usually my thought, is just kind of, be on top of your screening and listen to your body and get things checked out.
Yep. I think the fear is a big one.
It is.
I don't know. I think I had a pap smear at this last appointment, and then the lab called and they're like, everything's good. And I'm like, oh, why did you call me? Like, I just, got anxiety just like with that one good phone call. So I can't even imagine the anxiety if there was bad news on the other end of that voicemail. But I like to say the longer you delay in solving a problem, the bigger the problem gets. And so I think that's a really pertinent thing to add here. So if we move on to recovery, maybe using your own experience and patience. I've had one friend, and then obviously my grandma, who've had it, and they might have like a lymphedema sleeve, or like my grandma had a skin irritation from the radiation. Like, what are some of the most common side effects of the treatment itself, whether that be chemo, radiation, surgery? And then how can people really set themselves up for success post-treatment to speed their recovery, to reduce the risk of complications?
Yeah, so usually the main things we think of, I think, fall in a couple different categories. The first one is kind of localized treatment issues related to either surgery or radiation. And those are things like you mentioned, which is such a great thing to talk about, which is lymphedema, which is arm swelling. Fortunately, with the way that we do breast cancer surgery now, the chance is relatively low. But it turns out the very best thing you can do to prevent that from happening is to exercise and get into physical therapy to help with lymphatic massage and drainage, and also actually weightlifting. So it used to be that the thought was don't exercise with the arm that had lymph node surgery on, but we have really good randomized data that show that you should. So we send actually every single patient of ours who's had any kind of lymph node surgery or major breast surgery to see physical therapists.
That's awesome.
Makes a huge difference for people getting back into recovery, getting back into their life, and getting back safely. Because the last thing you want is you've been told you have 2 weeks, you can't exercise, and then you go back and do something crazy and mess things up, and now you're sore and you're hurt, and then you're afraid to go back. So we love physical therapists for that reason. Another one we see a lot of with radiation and with chemotherapy is actually kind of generalized fatigue. And a lot of that is physical side effects, but also kind of the emotional piece of it. And it's just a lot to go through on so many levels. I often say in that setting, the best thing you can do is give yourself grace, and let yourself get help. This is the time to rely on your connections. Many of us are not good at asking for help, but having emotional support, having physical, logistical support can make a huge difference with that piece of fatigue. And then, of course, knowing that your body needs more sleep. That's exactly what your body is telling you. And with radiation, I always say, go to sleep an hour or two earlier, because your body needs that to heal. You need that to fight off cancer. Your body needs that extra time. And then the final piece of it, I think from a complication standpoint, is thinking about the nutritional component. And there are pieces of this. So one is hydration, hugely helpful, right? It's something that is so important for healing. It's important if you have nausea from chemotherapy. It's important with radiation. We talk about trying, you don't have to go crazy, but adding extra protein in. Protein is really important for healing from radiation and also from surgery. And then the final piece of it is that I do think this is where the antioxidants, phytochemicals, all of that, again, people having chemo don't often feel like they want to have a salad, but they might feel like they can have some watermelon or some strawberries or something, that falls in kind of a sweeter category, but still is going to get you some of those benefits. So again, meet yourself where you are, but trying to prioritize those things does make a big difference.
Yeah. And we talked about this offline. We're having an OT on the show to talk about lymphedema. So if you have questions about lymphedema, especially as they relate to breast cancer, you can send me a message on Instagram at Zivly, and then I can ask those follow-up lymphedema questions with that OT. But she's just seen really cool results. So PTs can get trained in it. The person, it kind of depends on like the region, I feel like, on what PTs do and what OTs do. But here it seems like OTs do more of the lymphatic drainage. So I think that that's really cool that you guys refer to PT. That's not necessarily the standard of care everywhere. And so I think people's return to activities, gaining range of motion, just like stretching out the muscles again can be intense. So any other recovery-based tips? We talked about exercise. We talked about getting that emotional support, which I think is a huge piece of the puzzle. We talked about some nutrition tips. Anything else to help kind of someone prepare for maybe like reducing complications? What are some post-surgical complications that they might experience?
Yeah, I think the big ones, fortunately, most of these are relatively rare in the breast surgery world, things like bleeding or infection. And some of those are unavoidable and kind of go with the territory. We do know there are baseline things such as avoiding smoking and trying to minimize having things like diabetes and hypertension and trying to kind of get in a good place overall. Unfortunately, for a lot of people who get diagnosed with breast cancer, you don't have the time to kind of make those major changes. So what I like to say in those settings is really trying to do everything you can to stay active while you're healing, but stay safe. A lot of people think that after you've had surgery, lying in bed and not moving is the right thing, but it actually turns out that walking around, making sure that you are moving, you're staying active does make a difference for preventing things like blood clots. It helps with potentially if you're on narcotic pain medications that you don't have any side effects from a gastrointestinal standpoint. So I think that kind of moving in a gentle way is important. The other piece I always say, the people who go into surgery in the best place are the people who come out in the best place. And a lot of that is kind of overall logistical preparedness. So knowing, are there special bras you should have, which also reduces complications. People don't think about the fact it turns out it really hurts if you wear a seatbelt across your chest and you've just had breast surgery. So they make seatbelt pillows, and that can be really helpful. Getting your house set up for the first week or two after lymph node surgery. We don't want you stretching over up top like this because it pulls at the lymph node site. So if you have your mugs that you need for your coffee in a high shelf, then you're not going to be able to get them, especially if you live alone. So we often have a meeting with our patients of ideally about 2 to 3 weeks in advance and go over all those logistical pieces so that when you go home after surgery, your house, your world, your support is set up to support you in those first few weeks from a logistical and kind of details oriented standpoint.
Yeah, I love that. I love those little tips. I had a friend who had a breast procedure, and she even said, a couple of weeks later, it hurt to open a door. So just the pushing of the door, and you just want to think about the things, kind of like you said, standing in the shower, like feeling the warm water on your chest. It's like we take so much of our function and feeling for granted. So it's good to think ahead. So this has been a really interesting conversation. I hope that people have found it helpful. If you have breast cancer, if you know someone with breast cancer, if you're interested in reducing your risk for breast cancer, was there anything else that you wanted to cover or dive into today?
I was just thinking, Morgan, as you were talking about kind of recovery, the last piece I wanted to think about from recovery is that a lot of people having breast surgery are responsible for other beings, whether that's kids, whether that's aging parents, whether that's people in your workplace, as again, most people diagnosed with breast cancer are women, not everyone, but most are. And I think as women, as a general concept, we do tend to be used to kind of taking care of others before ourselves as a kind of big picture concept. And so I do think if you have been diagnosed, really trying to think about what your daily life looks like. Like I know you mentioned you have a 5-year-old, right? And I had young kids when I got diagnosed, and it turns out you can't recover from surgery and be picking up children or having them crawl all over you, or they can get their feet stuck in the drains. And so I do think, again, it's a unique time and one that is hard on so many levels from a control standpoint, but figuring out how to let people support and help you take care of the people in your life that you're used to taking care of, and also letting them take care of you. Again, it's temporary, it's short, you will get back, but it's such an important piece for the physical and emotional part of healing.
Yes, thank you. And we are all for that. Like, I am all for ask for help. Don't feel guilty. Like, put your health first. So people are not, if they listen regularly, they're very much used to that kind of messaging on ask for some dang help. Don't feel guilty. Don't feel bad. And it's a joy to help others. Really, I think it gives them joy to help you. And so I think people want to be there for you. If you're going through something hard, reach out. People want to be there. So, Anne, thank you so much for this conversation today. Where can people learn more about you?
So our website is annepeledmd.com. And then I like to put most of my content out on Instagram, which is at Dr. Dr. Anne Peled.
Perfect. Thank you so much for this conversation. And it was just wonderful to meet with you.
No, thanks, Morgan. It was really a delight. And again, I so appreciate your putting this out there for other listeners. I think it's really huge. So thank you for having me.
Yeah. Bye.
Bye.